Hello everyone. Now let's talk about various congenital anomalies of larynx. The first and the most important one is laryngomalacia because it is the most common congenital anomaly. What is laryngomalacia? Larynx, we know. What is Malaysia? Malaysia means laxity or soft. So the larynx is becoming lax or it is becoming soft. We can see the normal larynx picture in this slide and also the omega shaped epiglottis because the larynx is becoming soft, so it is taking different positions and it is causing laryngomalacia. Now let's see what are the structures that are involved in laryngomalacia. What are the structures that are affected by this condition? Epiglottis is affected, arytenoids affected, array epiglottic folds are affected. Now let's see what are the clinical features in this condition. There will be intermittent stridor because I have mentioned intermittent because the stridor is only seen in supine position because in supine position the omega shaped epiglottis I have already told, this omega shaped epiglottis will be moving backwards and closing the airway, so there will be stridor, and this condition, that is the laryngomalacia, is the most common cause of stridor in infants. Coming to the diagnosis part, the diagnosis is mainly through the clinical, and the stridor soon after birth we can observe, and stridor is present in supine position and it will be absent in prone position. This condition is because in supine position, as I already told, the epiglottis will be moving backwards and closing the airway, and while in the prone position the epiglottis is moving forwards and the airway obstruction is relieved. And this is the picture that is showing the omega shaped epiglottis which is seen in the laryngomalacia. Coming to the management part, we have to reassure the parents, and this condition will be improving by 6 to 12 months, so no further treatment is required in this condition. The next important one is congenital subglottic stenosis. As the name suggests, it is a congenital condition and there will be stenosis in the subglottic region, and it is the second most common congenital anomaly of larynx. In this picture you can see there is stenosis happening in the subglottic part. Mostly this stenosis is happening due to abnormal shape of cricoid cartilage, and the clinical feature will be stridor. The main difference of stridor from this congenital subglottic stenosis from the congenital laryngomalacia is the stridor will not change with posture. In the laryngomalacia we have already discussed, in the supine position stridor will be there and there will not be any stridor in the prone position. But here the stridor will be there if the child is in supine position or the child is in prone position. The stridor will not change. Coming to the management part, comparing with the laryngomalacia, there we are reassuring the child, but here we have to do some intervention, that is cricoid split. You can see the anterior cricoid split, and we have to reconstruct the laryngotrachea. Larynx and trachea should be reconstructed. So the answer is cricoid split plus laryngotracheal reconstruction. Thank you.